So what is interstitial cystitis?
So interstitial cystitis, I'll start with saying that it's a difficult diagnosis, right? I kind of think of it as a part of a chronic bladder pain syndrome. And the reason we say it's part of that chronic bladder pain syndrome is because there are lots of theories of why interstitial cystitis happen. But in simple terms, it's basically pain that happens in the bladder, right? It could be because there's one theory that maybe there's disruption of the bladder wall, which is causing that discomfort. There's another theory that it could be because of hypersensitive nerves. Maybe something happened, the nerves in the bladder are triggered, and now patients are feeling that pain all the time. There's another theory, which is kind of like, maybe there's mast cell activation, almost like an autoimmune kind of a disease, your own cells kind of attacking your bladder. So there's all these theories of why it happens, but the symptoms it causes is number one, bladder pain. For a lot of women, it could be urgency frequency. They may notice blood in the urine. It can be really debilitating because it's a chronic condition. It doesn't go away, but there are some options that we can offer patients to manage their symptoms better.
So let's go through some of those.
Yeah, absolutely. So again, you kind of have to think about why is it happening. So for a lot of my patients, they can actually identify triggers, whether it could be food like, we talked about, like caffeine, soda. Sometimes it could be spicy food, citrusy food. So if you can identify a trigger that causes that flare up, avoiding those can be helpful. Stress reduction, believe it or not, because for a lot of women, stress can be a trigger. I always tell my patients, how we have headaches or we get knots in our shoulders when we are stressed out. For a lot of women, it's kind of focusing on that pelvic area. They can have bladder pain. They can have pelvic floor muscle pain. So that could be one, avoiding stress or doing stress reduction techniques, whether it be yoga, exercises, swimming, whatever it is that works for you. There are some medications that we can offer patients. Of course, a lot of those medications can have side effects. So it's a discussion that I have with my patients. There are things such as bladder instillation, where we essentially fill up the patient's bladder with this cocktail of medications, which kind of helps calm that flare down. And then, after that, there are some options, which is not necessarily FDA approved for the pain component of the interstitial cystitis, but it can help with that urgency frequency, things like bladder Botox or sacral neuromodulation. And we can have that conversation with patients on an individual basis.
Yeah, it's a very complex disorder that requires sort of a multimodal approach and really working with a doctor who will take you through those steps and really work with you to get your quality of life better.
Yeah, and I think I'll add one more point to that is that, a lot of the times patients will feel that it's a bladder pain, but when we do an evaluation, when we do a pelvic floor exam, a lot of the time it's because of very tight pelvic floor muscles, what we call myofascial pain syndrome. So addressing that with a good pelvic floor physical therapist, not doing Kegels, it's actually the opposite of Kegels because you're learning how to relax those pelvic floor muscles. And I see my patients and they're looking at me like, what are you talking about? But yes, because those muscles, those bladder, the lower abdomen, it's all one component. They're not in isolation, and pain can present in all sorts of strange ways.
Well, thank you so much. Where can people find you?
Yeah, absolutely. So, I'm very active on social media. I do have a YouTube channel. It's my name, Dr. Nabila Noor. I'm also posting, educational contents on Instagram, on Facebook, on TikTok. So yes, please follow me. And of course, my website is www.drnabilanoor.com.